Somewhere in the American Southwest, a hiker steps into an old trail shelter. There are signs of mice, some droppings on the floor, a few nesting materials in the corner. The hiker doesn't touch anything, just walks through. But as they move, the disturbed dust rises into the air, and they breathe it in. That's all it takes. Within 1 to 6 weeks, they could have a fever, muscle aches, a headache. Sounds like the flu. But within days, their lungs could start filling with fluid. Their blood pressure could collapse. And right now, there's no specific cure. This is hantavirus. And as of this week, it's in the headlines again. This time aboard a cruise ship in the South Atlantic, with 3 people dead. Today we're going to explain exactly what hantavirus is, where it comes from, what it does to your body, and how worried you actually need to be, and what you can do to protect yourself. Let's go. The story of hantavirus doesn't begin in a lab or in a pandemic. It begins with soldiers. During the Korean War in the early 1950s, thousands of United Nations troops stationed along the front lines began falling mysteriously ill. They had fevers, they bled under their skin, and their kidneys started failing. Over 3,000 soldiers became sick with what was then called Korean hemorrhagic fever. For years, the cause was completely unknown. It wasn't until 1976 that South Korean virologist Ho Wang Lee identified the culprit, a new type of virus carried by a small field rodent. He named it Hantavirus, after the Hantan River near the area where soldiers had been infected, and a whole new family of viruses was born. What Lee had found was something that had almost certainly been sickening people for centuries. Rodents, which are mice, rats, voles, shrews, carry these viruses. The animals themselves don't get sick. They just harbor the virus in their bodies for life, shedding it in their saliva, urine, and droppings. For the rodents, it's nothing. For humans to come in contact with it, it can be devastating. Since Lee's discovery, dozens of different hantavirus species have been identified on every inhabited continent. And they cause 2 very different diseases depending on which part of the world you're in. Here's where hantavirus gets a little more complicated, in the best way possible, because understanding this distinction could actually save your life. In Asia and Europe, hantaviruses primarily cause a disease called hemorrhagic fever with renal syndrome, or HFRS. The main targets are your kidneys and your blood vessels. People develop fever, back pain, headaches, and then, in more severe cases, bleeding complications and kidney failure. The case fatality rate in Asia and Europe is generally under 15%, and in some European strains, it's less than 1%. In the Americas, hantaviruses hit differently. Instead of kidneys, they go straight for the lungs and heart, causing what's called hantavirus cardiopulmonary syndrome, HCPS, or hantavirus pulmonary syndrome, HPS. The progression here is rapid and brutal. Fever, muscle aches, and then suddenly the lungs start filling with fluid. The heart struggles to pump. Patients can go from feeling unwell to being in life-threatening respiratory failure in a matter of hours. The case fatality rate for HCPS in the Americas can reach up to 50%. 1 in 2 people who develop severe HCPS may not survive. In the United States, cases are rare. Fewer than 1,000 total have been reported since tracking began. But the fatality rate sits around 40%. The primary strain in the U.S. is called cynomolvirus, and it's carried by the deer mouse, common across the American West. In 2025, the anchor Gene Hackman's wife, Betsy Arakawa, died at their New Mexico property. State medical examiners determined she died from hantavirus pulmonary syndrome, likely after contact with rodent droppings in outbuildings on their property. It was a shocking reminder that this disease doesn't only happen in remote wildernesses. It can happen anywhere rodents go. The key thing to understand about hantavirus is how it travels from rodent to human. You don't get it from a rodent running across the floor. You don't get it from seeing a mouse in your house. The danger comes from contact with infected rodent urine, droppings, or saliva, and crucially, from breathing in air that contains particles of those materials. When dried rodent droppings are disturbed, they are swept, kicked, or stirred up, microscopic virus particles can become airborne, and when you breathe that air, the virus enters your respiratory system. That's the primary route of infection, and it explains why people cleaning out old cabins, barns, sheds, or poorly ventilated spaces are at elevated risk. Infection can also occur, less commonly, if contaminated materials get into a cut on your skin or into your eyes, nose, or mouth. For most hantaviruses, that's where the transmission chain ends. The virus does not spread between people. But there is one important exception. Andes virus, primarily found in Argentina and Chile, is the only currently known hantavirus that can spread from person to person. This transmission appears to happen through close and prolonged contact, particularly among household members or intimate partners, especially during the early phase of illness. It's uncommon, but it's real, and it matters enormously, as the 2026 cruise ship outbreak is now showing us. On May 4, 2026, just days ago, the World Health Organization issued an emergency outbreak notice about a cluster of hantavirus cases linked to a cruise ship. Here's what we know. Based on the WHO's Disease Outbreak News report, the ship is the MV Hondius, a Dutch-flagged vessel operated by Ocean-Wide Expeditions. It departed Ushuaia, Argentina, on April 1, 2026, on a voyage through some of the most remote places on Earth: Antarctica, South Georgia, Nightingale Island, Tristan da Cunha, St. Helena, and Ascension Island. The ship was carrying 147 people, 88 passengers and 59 crew members, from 23 nationalities. As of May 4th, 7 cases have been identified, 2 confirmed by PCR laboratory testing, and 5 suspected. 3 people have died. 1 patient is critically ill in intensive care in South Africa. The first person fell ill on April 6th, just 5 days after departure. His symptoms were fever, headache, and mild diarrhea. By April 11th, he had developed respiratory distress and died on board. His wife, who was a close contact, went ashore at St. Helena on April 24th with gastrointestinal symptoms. She deteriorated rapidly on a flight to Johannesburg and died at the hospital there on April 26th. She was later confirmed positive for hantavirus. A 3rd passenger developed pneumonia on April 24th, was medically evacuated to South Africa, and remains critically ill. Both the first 2 victims have traveled through Argentina prior to boarding. The source of the infection is still under investigation. What makes this outbreak especially significant is that Andes virus, the only hantavirus known to spread between people, is the strain found primarily in Argentina and Chile, exactly where the ship originated. The question of whether there was person-to-person transmission on board is one investigators are urgently trying to answer. As of now, WHO assesses the risk to the global public as low. There's no need for panic, but this case is a powerful illustration of how a rodent-borne virus from South America can follow people halfway around the world. Let's talk about what the virus actually does once it's inside you. After exposure, symptoms typically appear 1 to 6 weeks later, though in some cases it can take up to 8 weeks. That incubation period is why hantavirus is so tricky to detect early. People often don't connect their symptoms with a rodent encounter that happened weeks ago. The early stage looks almost identical to the flu. Fever, intense muscle aches, especially in the thighs, hips, and back. Headache and gastrointestinal symptoms like nausea, vomiting, and abdominal pain. Then, in HCPS cases, comes the dangerous turn. About 4 to 10 days into the illness, coughing begins and shortness of breath rapidly intensifies. Fluid starts accumulating in the lungs. Blood pressure drops. The disease progresses to what doctors call acute respiratory distress syndrome. The lungs essentially cannot do their job. At this stage, patients need intensive care, mechanical ventilation, meticulous fluid management, and in most severe cases, a machine to temporarily take over the work of the heart and the lungs. There is no specific antiviral treatment that cures hantavirus. There is no approved vaccine. The only approach is supportive care, keeping the patient alive through the critical window, managing their breathing and blood pressure, and waiting for their immune system to fight back. Early access to intensive care dramatically improves the odds. Now for the part that actually gives you control: prevention. The CDC and WHO are clear. The primary strategy against hantavirus is reducing contact between people and rodents. And the good news is that steps required are not complicated. First, if you're cleaning a space that might have had rodent activity, do not dry sweep or vacuum. Sweeping stirs up particles in the air. Instead, dampen contaminated areas with a disinfectant spray first, then clean with a wet cloth or mop while wearing gloves. Dispose of materials in sealed bags. Second, seal the gaps. Mice can squeeze through openings as small as a dime. Check your home, cabin, vehicle, or shed for any cracks or holes where rodents might enter and seal them. Third, store food properly. Rodents come where there's food available. Keep all food, including pet food, in sealed containers. Fourth, if you work in environments where rodents are common, farm workers, pest control, wildlife researchers, hikers staying in old shelters, consider wearing an N95 respirator mask when working in enclosed areas that may be contaminated. Fifth, if you have a rodent problem in your home, take it seriously and address it properly. The longer rodents are present, the more contamination builds up. And if you develop flu-like symptoms, especially with intense muscle aches, and you've had any potential rodent exposure in the past 6 weeks, tell your doctor. Early medical attention significantly improves survival. The disease is rare, but when it's caught early, there is a much better chance of getting through it. Hantavirus is not a disease most people think about. It's rare, and for most of us, the actual risk of encountering it is very low. But it's also a disease that punishes ignorance more than most. A routine cabin cleanup, a few minutes in a dusty shelter, a trip to the wrong part of South America at the wrong time. These are the moments where hantavirus enters a person's life. And when it does, it moves fast. The 2026 cruise ship cluster, 3 deaths on a peaceful voyage through some of the world's most remote and beautiful places, is a reminder that this virus is still out there, still evolving, still capable of surprising us. Know how it spreads, know the symptoms, and know that a few simple habits like dampening before cleaning, sealing gaps, storing food properly, are all it takes to dramatically reduce your risk. Thanks for watching. If you want more on emerging diseases and the science of how they work, hit subscribe. We'll keep going.